Tonight, the Prime Minister to address the nation following a NEMAC meeting on the issue of beefing up COVID-19 protocols. The Medical and Dental Association calls for a 2-week judicial shutdown and a national curfew after the island recorded 77 cases of COVID-19. And members of the public air their views on whether the government should indeed shut down the country.
This is the Hot 7 Nightly News with Lovelyz and Amy Booth.
Good night. It is Friday, the 29th of January 2021. Welcome to the Hot 7 TV Nightly News. I'm Lovely St. Amy Joseph. Thank you for joining us. Prime Minister Allen Chastanet is expected to update the nation ahead of the end of the current protocols in effect. The National Emergency Management Advisory Committee, NEMAC, and various stakeholders met on Friday to discuss St. Lucia's national response to the COVID-19 pandemic. At that meeting, stakeholders obtained suggestions and recommendations for further strengthening of protocols to reduce the rate of infection. Senior Communications Officer Nicole McDonald says there will be further deliberations by the Cabinet of Ministers on the recommendations from the Command Center and NEMAC stakeholders before the Prime Minister addresses the nation.
As many St. Lucians are aware, we have had a rise in the number of cases, and it's very important that we go through this consultative exercise because, for our nation to succeed, everybody needs to be on board. We all need to do this together. As the Prime Minister had said over and over, the enemy is COVID-19, and we all have to come together to fight this enemy. So that was the purpose of the meeting this morning, was to ensure that all ideas, suggestions, everything could have been put on the table for the Cabinet of Ministers to make a decision.
The current protocols come to an end on Monday, the 1st of February 2021. The St. Lucia Medical and Dental Association has called on the government to implement a judicial shutdown of the country. The president of the association says as the cases continue to increase, there needs to be more stringent measures put in place to safeguard the people of the country. Dr. Merle Clark has called on the government to go back to the drawing board and prioritize the health and lives of people with a shutdown and the implementation of a national curfew. Genevieve Gonzague has more in this report.
St. Lucia has officially passed the 1,000 mark with the number of COVID-19 cases recorded on island. At present, there are 505 active cases, 77 of which were confirmed on Thursday. The president of the St. Lucia Medical and Dental Association, Dr. Merle Clark, has called for a judicious shutdown of the country and other more stringent measures to clamp down on the current spike in cases.
A judicious shutdown of all but essential services for a period of 2 weeks in the first instance. By judicious, we mean this has to be done in a way that does not cause panic. We do not want panic. The supermarkets, so we could get our groceries, would remain open as per our recommendations, and certainly other essential services, doctors' offices, etc. Of course, with modifying the way that things are done. Implementation of a curfew between the hours of 6 p.m. and 6 a.m. Immediate ramping up of testing, including the use of rapid testing, that we all understand and we know that there is a huge backlog as it pertains to testing because of the sheer number of cases that we are seeing. The time certainly has come, as we said in our release last week, for rapid testing to become an integral part of our national strategy.
Dr. Clark says the officials need to go back to the drawing board and rethink their strategies.
Any life lost prematurely is one too many. We are cognizant of the need to balance lives and livelihoods. Livelihoods and the economy, however, can be revived. Not so the precious lives lost. We will continue to valiantly battle in the front line, ensuring that our fellow citizens receive the absolute best care possible. Our system, however, has surpassed its limits. We need to re-strategize, regroup, reset. We cannot afford to wait.
She says despite the request by the SLMDA, members of the public should not panic.
This is not a call to panic. It is a call to unite by staying apart. This for our very survival. Together, we can indeed win this war. we can all do something. We can all do our part. Adhere to the protocols. Let us all do this, St. Lucia, so we can have a better tomorrow.
St. Lucia has recorded 13 COVID-19 related deaths and 1,106 cases. One individual is currently in critical care at hospital. Reporting for Hot 7 News, I am Genevieve Gonzalez.
In the past 2 days, the island has recorded its all-time highest number of COVID cases, 137 to be exact. These numbers are expected to continue to rise in the coming weeks. So with the risk of contracting the virus being even higher than the number of cases, we sought to find out from the general public whether they agree with the recommendation for the government to shut down the country. Rochelle Gonzalez tells us more.
The number of confirmed cases on island of COVID-19 are at an all-time high, and so are the risks of contracting the virus. Now, although the PM has stated on numerous occasions that there will not be a lockdown, indications suggest otherwise. So with that, we took to the streets to ask members of the public whether they think a shutdown should be on the cards.
Well, honestly, to tell you, locking down the country right now is not in my favor because I work in hand to mouth for so long, and when the country locked down, it will be hard for me to, just hold myself. But I feel it's up to the people to do the necessary precautions that they have to stay safe.
For me, the Prime Minister should lock down the country for a whole month because people's lives are in danger, you know what I mean? All of the protocols and what you're talking about, that is the time right now.
The Prime Minister should lock down the country because too much cases we get in there with that disease. So if you don't lock down the country, so you will get more. So therefore you better close it down.
No. Right. If you lock down the country, things will become harder one.
Yes or no? It's a double whammy answer. Lock it down, the economy gets all messed up. Keep it open, people die. Really, the PM has got a heavy task, I don't know who's advising him, but whoever is advising the PM, he has to be very, very intelligent.
Of course, we should close down that country for at least 14 days for the incubation period, all right? We should have a lockdown, or likewise, it go for the hotel also. We don't do separated because you cannot tell people wear masks. We have to follow protocol. But basically, we need that shutdown. That number is too high. So everybody is at risk. Our workforce is at risk, our children is at risk, our community is at risk. Our economic development is going down day in and day out. So we need that lockdown, we need that shutdown.
Well, as the saying goes, home is where the heart is. But whether there will be a shutdown that will cause us to stay home or not is left to be seen. Reporting for Hot 7 News, I am Rochelle Gonzalez.
Thank you, Rochelle. Stay with us. Still to come, free COVID testing at the VG Sports Complex extended to February. The LIAT administrator warns of possible legal action if regional governments do not help pay employees severance. And Beaufort South hopeful Herman Gil Francis details his plans to bring prosperity back to the South.